Dr. Brooke Pelkey, Associate Professor, and Katie Kerr, Assistant Professor in the Health Informatics and Information Management Department at the College of St. Scholastica, will be demonstrating the Implement HIT ICD-10 education application. Brooke and Katie are HEMA-approved ICD-10 trainers and are members of the HEMA Ambassador Program. Their focus is on education and adult learning styles. Dr. Andres Jimenez is the founder and CEO of Implement HIT. He is a physician with a vast amount of knowledge in instructional design and online learning and information systems. He also has experience with over 100 EHR implementations. The College of St. Scholastica has partnered with Implement HIT to provide this great learning platform for ICD-10. The provider training was developed by Implement HIT with sponsorship from the American Health Information Management Association. Additionally, the training suite for healthcare includes customization to individual EHR platforms, some of which you will see listed on this slide. The purpose of the Implement HIT platform is to provide education that is targeted with bite-sized delivery methods. It's available anytime, any place, from any location, and from any device. This is really critical as physicians and nurses have a lot on their plates and have almost no time to learn how to use technology to become more productive. There's also an increase in the number of ICD-10 codes, which is extremely daunting. Planning for provider clinical documentation improvement education after the ICD-10 implementation is not the best approach. It's really important to have providers trained prior to the go-live. Taking providers out of the care setting, sitting them in front of a screen, and going through lengthy PowerPoint presentations on ICD-10 and documentation requirements is not realistic and will not engage providers in the ICD-10 education process. For this reason, the College of St. Scholastica decided to partner with Implement HIT because of their instructional design framework and educational philosophy in training providers and coders and billers on ICD-10. We truly believe that our method will work the best for busy providers and other healthcare professionals. We all know how critical documentation is. To successfully address and educate providers on this important element prior to implementation, we have to address it in a bite-sized and need-to-know learning basis. This slide focuses on a few testimonials that provide a perception of providers by using this type of method. We'll be going over a demonstration of the application in a moment, but here you can see a snapshot of a live system content. This will be different because I'll be using a demo system, but this information is an example of what your organization could utilize if you select these options. For example, in the yellow highlighted section, this shows a banner that can stream relevant RSS feeds that may be valuable to your providers. Within the red section, this shows the skills that have been completed, incompleted skills, or other skills that have been assigned to the provider. The green section shows the learner's performance tracking. This is a snapshot of all the skills that have been completed individually and across the organization. Finally, the blue area allows the organization to track progress on key performance indicators that you select for your own providers. Now I'll give you a high-level overview of the application before we get into the demonstration itself. The Implement HIT application has many benefits. Here are just to highlight a couple of these. The education is peer-reviewed information, so you know that providers in your organization can have confidence in the education they're receiving. The application and the education can be accessible within your organization's EHR or any device a provider you or your organization prefers. One of the greatest benefits is that the system can be used as a continual resource post-training. As a resource, you can look up the content as providers are documenting within the EHR during the ICD-10 Go Live and into the future. Finally, the education can be utilized in an EHR-specific environment and allow your providers to apply the knowledge they've gained to the EHR they're going to be using in your organization. Implement HIT has partnered with many of the large vendors to make this possible. The training is based on skills the provider is in need of. When they log in, they will be developing a role that's in a specialty within the area that they practice. Social suggestion is also used to incorporate resources you want your providers to utilize at your organization. And the organization can integrate classroom training. And additionally, there is a mobile app that can be utilized that has voice recognition. And this would be a great opportunity to use as a resource. The education is targeted, can be self-paced, or received via audio, and each skill lesson is only 3 to 5 minutes in length. The application will provide you with education on the general top diagnoses. However, if you want more specific focus of your organization's diagnoses, you have the option to have Implement HIT perform an assessment on your data to give more tailored skill targets. Here is a snapshot of a demonstration targeting education when Implement HIT assesses your data. In this instant, Implement HIT assessed an organization's internal medicine physicians and uncovered that Dr. Smith was undercoding his level 4 visits in comparison to his group and national benchmarks for his specialty. This can be delivered via targeted training by Implement HIT platform. We'll now demonstrate how the education is delivered. As I mentioned earlier, the education platform can be accessed at any time, anywhere from any device. It is also training software available. You have the option of using Dragon speech technology within the application. You can ask a question and be provided your response directly on the screen. This example shows documentation elements needed for the diagnosis when a provider is documenting for sore throat. Alternatively, you can use non-speech entry to utilize the same resource. The information is selected from the screen instead of spoken. Streptococcal sore throat is selected and the documentation education is delivered on the screen in a text format. There are other additional options that can be used with the application. This is up to each individual organization and their interests. For example, there are different ways to motivate your providers, and here you can see one of the views they will receive prior to starting a lesson or a skill. Providers can receive various types of reminders and information about their progress. Peer feedback and social suggestion is also used to help adopt the information they receive and provide even more focused training. Additionally, there are several ways your organization can look at the utilization of the application and the skills of each module for each provider. Here's an example of a dashboard showing the utilization of Implement HIT application and the skill modules within the last 30 days. If your organization has multiple sites, you would be able to see skill completion by site, and here's an example of that report. If your organization has multiple divisions within an organization, such as home care, hospice, pediatrics, etc., you can also view skills completion by division. If you'd like to even drill down further, there's a report showing daily utilization by site. Finally, there's a detailed report that can be generated to show the skill progress by user. This report shows the percent of users that have completed all skills, the percent that have made partial progress with their skills, and the percent of users that have not made any progress at all. Now we'll transition into showing you a demonstration of the actual implementation application.